lot about the communities that have been hit hardest by the pandemic, like our older population and our communities of color.
And now we're learning about the toll it is taking on the LGBTQ community. Tanisha Cordell joining us live this morning with the new research from Case Western Reserve University.
That's right. Katie Danita, teachers from the University School of Nursing really wanted to take a look at how the pandemic was impacting and is impacting sexual or gender minorities, otherwise known as SGM, just a broader term for the LGBTQ community. And here's the thing, what they found, they say, was extremely concerning. Scott Emery Moore and his research partner reached out to more than 1,300 people over several months last year. Moore says they found the isolation of the pandemic hit the SGM individuals hardest, causing spikes in anxiety and depression.
This chosen family, or family of choice as we often call it, is a bedrock and foundation for the social support that many sex and gender minority individuals use to manage and cope in non-pandemic times.
It all lines up with symptoms the LGBT Center of Cleveland has been seeing this past year. Director of Programs Gorner Farasta says those concerning symptoms are particularly prevalent among older members of the LGBTQ community.
Not everybody has access to technology. Not everybody has access to smart devices or even internet to be able to connect with the center in this world of virtual programming.
And she says this community can face a higher risk of contracting the virus because of disparities in healthcare, especially gender-affirming healthcare. That leaves them more vulnerable to underlying conditions.
A lot of people have a lot of traumatic experiences just going to the doctor because of the way that they're treated. They might be misgendered. They might be what we call dead named, where the former name is used instead of their chosen name.
Moore also noted the research team was working with a largely white group of participants. And he says race and ethnicity come with their own stressors and barriers.
If it's this bad for white, cis individuals, how might it be for people who are people of color and who identify as sex and gender minority individuals?
Now, there are programs and resources being offered at the LGBT Center right here in Cleveland for those individuals who may feel a little isolated or just cannot access any services virtually. Katie?
Tanisha, thank you so much for that new report. Today, the U.S. House